Choose the correct statement about lamotrigine. It is a broad-spectrum anti-epileptic drug. Select the anti-epileptic drug that in addition is the preferred treatment for post-herpetic neuralgia and pain due to diabetic neuropathy. That is gabapentin. Sodium valproate has been shown to prolong neuronal sodium channel inactivation, attenuate T-type calcium current in neurons, inhibit degradation by GABA transaminase. Sodium valproate should be used with caution in young children because they are particularly at risk of developing the following adverse effect, that is hepatitis. The preferred drug for suppressing febrile convulsions is rectal diazepam. Despite having anticonvulsant action, diazepam is not used in the treatment of epilepsy because it causes sedation. And its anticonvulsant action wanes off with chronic use. Clobazam is a benzodiazepine used as antiepileptic. The antiepileptic drug which suppresses maximum electroshock as well as Kindle seizures raises fentanyl tetrazole threshold and is effective in both generalized tonic-clonic as well as absence seizure is sodium valproate. Select the drug having a narrow spectrum anti-epileptic activity restricted to absence seizures, ethosuximide. The drug of choice for trigeminal neuralgia is carbamazepine. The following statement is not true of carbamazepine. First of all, two statements are: it generates an active metabolite, its plasma half-life decreases to nearly half of the original value after chronic use, it is being used in mania. But the incorrect statement is: it is not effective in complex partial seizures. The following antiepileptic drug raises pentylene tetrazole seizure threshold but does not modify maximal electroshock seizures. It's ethosuximide. Select the antiepileptic drug that is effective in manic depressive illness as well. That is carbamazepine. The following antiepileptic drug is likely to cause hyponatremia as a side effect, especially in elderly patients. That is carbamazepine. The following adverse effects of phenytoin is related to high plasma drug concentration. That is ataxia. The following drug displaces plasma protein bound phenytoin as well as decreases its metabolism. It's sodium valproate. Carbamazepine possesses the following property not shared by phenytoin, that it raises threshold for pentylene tetrazole conversions. Phenytoin appears to derive its anticonvulsant action from selective inhibition of high-frequency neuronal discharges. The characteristic feature of phenytoin pharmacokinetic is capacity-limited metabolism saturating at higher therapeutic concentration range. The most probable mechanism of anticonvulsant action of phenytoin is prolongation of voltage-sensitive sodium channel inactivation. The following anti-epileptic drug is most likely to impair learning and memory and produce behavioral abnormalities in children. That is phenobarbital. Which of the following is not a CNS depressant but increases the tendency to fall asleep at night? That is melatonin. The barbiturate having higher anticonvulsant sedative activity ratio is phenobarbital. Select the correct statement about flumazenil. It has no CNS effect of its own but blocks the depressant effect of diazepam as well as stimulant effect of beta-carbolines. The general principles in the use of hypnotics include the following except. So, the general principles in the use of hypnotics are: a hypnotic may be used intermittently for up to 2 to 3 weeks in short-term insomnia due to emotional stress. All hypnotics aggravate sleep apnea. A hypnotic with slow elimination is preferred in patients with early morning awakening, but the incorrect statement is in patients with chronic insomnia, a hypnotic should be used regularly. Diazepam is indicated in the following conditions except. So, diazepam is indicated in tetanus, febrile convulsions, cardiac catheterization, but not in generalized tonic-clonic epilepsy. The following drug is used to reverse the CNS depression produced by diazepam. Flumazenil. Choose the drug that has been found to be more selective for the omega-1 subtype of benzodiazepine receptor and produces hypnotic action but little anti-anxiety, muscle relaxant or anticonvulsant action. That is zolpidem. Zolpidem differs from diazepam in that its hypnotic action shows little fading on repeated nightly use. The following is a very potent and short-acting benzodiazepine whose use as hypnotic has been noted to cause psychiatric disturbances in some cases. That is triazolam. Which of the following statement is not true of zopiclone? So the true statements are: it is a non-benzodiazepine hypnotic with efficacy and safety similar to benzodiazepine. It does not produce rebound sleep disturbances on discontinuation. It is used to wean off insomniacs from regular benzodiazepine use. But the incorrect statement about zopiclone is: it does not act by potentiating GABA. The following drugs exert their action through the GABA A benzodiazepine receptor chloride channel complex except baclofen. At a single hypnotic dose, the pharmacokinetic of diazepam is characterized by slow elimination with marked redistribution. The primary mechanism of action of benzodiazepine is facilitation of GABA-mediated chloride influx. Select the drug that antagonizes diazepam action non-competitively. That is bicuculline. Select the correct statement about benzodiazepines. All benzodiazepines facilitate GABA-mediated chloride influx into neurons. Hypnotic dose of diazepam produces the following action: decrease nocturnal gastric secretion. Currently, barbiturates are primarily used as anti-epileptic. Benzodiazepines differ from barbiturates in the following aspects except. So, benzodiazepines differ from barbiturates in they have higher therapeutic index, they have lower abuse liability, and they do not induce microsomal drug metabolizing enzyme except they have a steeper dose response curve. Hypnotic benzodiazepines increase the period of time spent in the following stage of sleep. Stage 2. The mechanism of action of barbiturate differs from that of benzodiazepine in that they have both GABA facilitatory as well as GABA mimetic actions. Which of the following processes plays the major role in terminating the action of phenobarbital? That is renal excretion. Ethanol is used in methanol poisoning because it inhibits the metabolism of methanol and generation of toxic metabolite. Which of the following is a specific inhibitor of the enzyme alcohol dehydrogenase and is useful in the treatment of methanol poisoning? Fomepizole. Barbiturates exert the following actions except analgesic. Barbiturates exerts anticonvulsant, anti-anxiety and respiratory depressant action. Select the drug that has been found to reduce alcohol craving and chances of resumed heavy drinking by alcoholics after they have undergone a detoxification program, that is naltrexone. Disulfiram is used for the treatment of alcoholics psychologically but not physiologically dependent on alcohol.